You're washing your vagina completely wrong, and I'm going to explain why. There's a lot of bad advice online about this, and also this pressure on us as women to have a fragranced vagina. Every woman should have access to the right information so you can decide for yourself how you want to do it. Hi ladies, welcome to Wellness Wisdom, where we talk about all things skin and women's health. In today's video, we're going to clear up the vagina versus vulva debate. I'll explain why you should wash one and not the other, how to wash yourself safely, and how to keep everything healthy. We'll talk about whether water alone is enough, if you should use fragranced or unfragranced products, whether wipes are safe, which methods to definitely avoid, and when it's time to see your doctor. I believe we should all be familiar with our body parts and the correct names to describe them, and there shouldn't be any shame in that, especially when it comes to the vagina and the vulva. We should also know what everything looks like, so we can recognize what's normal and what isn't. That way, if something doesn't look right, you can take action. I saw a statistic recently that said 45% of women couldn't label their vagina on a diagram, and I thought, that's something I'd really like to change. If you've watched my channel before, you know we're all about health and education, so I've even created a little roadmap for you, with labels just in case. The first thing to clear up is that what most women call their vagina is actually their vulva. The vagina is an internal organ. You can't see it from the outside. It's a muscular tube that runs from the cervix, which is the neck of the womb, to the outside world. It's what we call a potential space, meaning it only stretches and opens when something is passing in or out. The vulva, on the other hand, is all of the external genitalia you can see. The outer lips, inner lips, clitoris, clitoral hood, and the mons pubis, the fatty area over the pubic bone where hair grows. If I wanted to be poetic, I'd say the vulva is like the frame and the vagina is the picture inside it. A lot of women also can't describe the function of the vagina, so let's talk about that. The vagina allows your period and discharge to leave the body. It receives the penis during sex, it holds sperm while it waits to pass into the uterus. And of course, it's the passageway for childbirth. Now for the big question, should you wash your vulva? Yes. Should you wash your vagina? No. The reason is simple. The vagina is an internal organ, and like most internal organs, it cleans itself. It does this in two main ways: through vaginal discharge, which flushes out bacteria, old cells, yeast, and blood, and through its natural acidic pH, which helps protect against harmful bacteria and viruses. The vulva, though, does need washing. This is where things can get confusing because different sources say different things. Some recommend only water, others say soap, and others say avoid soap altogether. But think about it. If you tried to wash your skin with just water, would it really feel clean? The vulva is exposed to sweat, discharge, menstrual fluid, oils, even semen, and water alone won't remove all of that. Oils and water don't mix, which is why you need a surfactant, what you find in cleansers or soap, to lift the oils, bacteria, and dirt so they can be rinsed away. On top of that, the groin has lots of sweat glands that can create body odor when broken down by bacteria. And the area is usually covered all day by underwear and clothing, sometimes even pads or liners. So yes, the vulva needs proper washing. Just letting bubbles from your shower run down is not enough. That would be like trying to wash your hands by soaping your elbows and letting the suds trickle down. So here's the best approach. Use lukewarm water, not hot, because hot water strips away natural oils and leaves the skin dry and irritated. Use your hands instead of a cloth or sponge, unless you specifically need a little exfoliation for ingrown hairs. Choose a gentle, unscented cleanser rather than fragranced products, which can increase your risk of irritation, dryness, or upsetting the natural vaginal bacteria. Focus on the external parts, the mons pubis, the groin, the outer and inner lips, both sides, the clitoris and clitoral hood. Never put soap inside the vagina. Then wash the perineum and anus afterwards, always moving from front to back to avoid spreading bacteria. Rinse with lukewarm water and pat the area dry with a clean towel instead of rubbing. Most women don't need a moisturizer here, but if you do, choose an unscented one. Finally, put on clean underwear. And remember, new underwear should also be washed before wearing. Now, how often should you wash? Once a day is plenty, twice a day if you're on your period. More than that can cause dryness and irritation. Wipes are okay occasionally, but showers are better, and always choose unscented wipes. Sitting in a bath is also not enough to properly clean the vulva. As for douching, absolutely avoid it. Flushing water or solutions inside the vagina disrupts the healthy bacteria and pH and increases your risk of thrush, bacterial vaginosis, STIs, and even complications with pregnancy. Vaginal deodorants should also be avoided. Vaginas naturally have a scent, and trying to mask it with perfumes can cause irritation and even cover up signs of infection that should be checked by a doctor. So when should you see your doctor? If you have ongoing dryness, irritation, or itching, if your discharge changes in smell or color, if sex becomes painful, if you feel burning or stinging when you urinate, if you notice lumps, blisters, warts, or unusual bleeding, or if your periods stop earlier than expected. And if you're ever unsure, it's always better to go and get checked. Doctors would rather reassure you early than treat something that could have been picked up sooner. Please don't let embarrassment stop you from seeking help. Looking after your health is what matters most. Those are my thoughts. I'm not saying you have to do it exactly my way. We all have different routines. But I do want you to have the right information so you can make the best choices for yourself. Thank you for watching my video, and if you know someone who might benefit, please share it. And as always, leave me your comments and questions below and I'll be happy to answer them.